Hello friends, I am Dr. Manoj Bachhav, plastic and cosmetic surgeon from Nashik, and we are talking about hair transplantation. We are trying to deliver scientific information regarding various aspects of hair transplant. Today I am going to speak about the donor area for the hair transplant, the preferred donor area. If the scalp hairs are less, then what are the other options for the donor area? Then how long does the transplanted hair stay? Can we cut or trim the transplanted hair, etc.? So let us start with the first question, that is, what is the preferred donor area for the hair transplant and why? See, for the preferred donor area for the hair transplantation is the back hairs or the occipital hairs. Now, why it is preferred? If you see the hair while doing the hair transplant, once we take the hair from the back, the donor area, they are not going to grow back there again. That means the donor area is a limited thing. Now, why we choose from the occipital or the back? Basically, three broad reasons. First thing, the back hair, they grow straight. So even if we take while taking the hairs from the donor area, we take in a zigzag or specific pattern so that the remaining hair will go straight and cover the donor side, so that you don't have any patches of hair loss or alopecia. So first thing is they grow straight. Second thing, they are not in the visible area, they are on the back side. And third and most important thing is these hairs are genetically resistant to the hormonal changes. If you see any bald person who has lost his hairs, they still have a strip of hairs on the occipital or the back region. Now, if we say the hair loss is because of the male hormones, testosterone, and because of the pollution and genetic changes, genetic predisposition. So then it should affect all the hairs simultaneously in the equal fashion. Then why do they affect only the frontal part and why they don't affect the back part? That is because these hairs are genetically resistant to hormonal changes, and that is the quality of this hair that we use while doing the transplant, and that is why they stay longer. Okay, so this is the grade 1, I'll say. If we consider for the hair transplant, this is the grade 1 donor area. Now second, if you don't have the adequate donor site on the back side, then the second preferred site is beard hairs, and the third preferred site for the body hair transplant is chest and other body parts such as back. Now the beard hairs, why it is the second choice and why not the first choice? Many patients, they say ki, sir, I have adequate hairs on the beard and the chest, you just take from here and don't touch my backside. So we tell them, yes, these are the options, the backside is the grade 1. Because the beard hairs, if they grow for a specific length, they are going to turn curly. No one has the silky beard. So the curly hairs, we cannot put them in the front, we need to place them in the middle or the back side. So this is the one drawback for the beard hairs, but though they have a strength, they are going to grow curly. Second thing, for the chest hairs, they are very flimsy, or the strength is definitely lesser than the occipital hairs. See, we never shave our chest and the back regularly. That means the growth of the hairs is fixed, and that is this they grow for a small length only. So that is why they are the last options, and they are to be used not for the front, for the middle and the back hair, to be mixed with some occipital hairs. So this is regarding the donor area. Now the next question is, how long does the transplanted hair stay? The answer of this question is already answered in my first question, that if you look scientifically, these hairs are genetically resistant to the hormonal change, and that is why they are going to stay longer. But you need to preserve your own hairs in that area, because they are prone for hair loss. You need to maintain it with some specific medications. Now this is regarding how long does the hair stay. So they are definitely going to stay long, rest assured. Now the next question, can we cut them, can we trim them, can we dye them? Yes, you can cut them, you can completely shave them with the blade. They are going to grow back again. You can dye them, and you can do any type of hairstyle you want. So this is regarding the donor area and the quality of the hairs. Next vlogs, we are going to talk about whether the hair transplant is a painful procedure, how long does the procedure takes, what is the cost involved in the hair transplant, etc. Thank you.